week at the 5-Star Senior Center in South St. Louis. The card games are underway. Turkey a la King is on the lunch menu. But Dee McGee was here to talk about the disappearing donut hole.
Because usually I get at least 2 or 3 hands that are doing this, going, I'm in the donut hole.
The donut hole has been part of Medicare since 2006. That's when the Part D prescription drug program started.
Just hit go, and that'll take you right to the Medicare website.
People 65 had to sign up for one of the many plans. They still do. But at some point, the benefits stopped. The out-of-pocket costs for drugs went up. Full benefits would kick in if you could afford to get there. Yeah. Did you think there were people who stopped taking medications?
I know there were people that stopped taking medications. They had no idea how they could afford them. It literally was groceries or medicine.
Boy, we shouldn't call it donut hole. Those are wonderful, with coffee. It's great. But maybe we should call it the gutter, because you fall in it and it's slimy and awful and you just hope to get through on the other side.
SLU Public Health Management professor Stephen Howard says studies back up McGee's experience.
And they had found that a large portion of people would stop taking their meds altogether when they hit the gap because they couldn't afford to cover it at all.
But that is changing.
So it looks like we're headed in the right direction with closing the donut hole. By 2020, the donut hole should be closed, and then it'll be pretty seamless.
McGee is with the faith-based SGSM network and works with the St. Louis Area Agency on Aging to help seniors navigate the programs and benefits and changes and explain what is and is not happening under Obamacare.
There are a lot of questions, but even more, people need more education to know that they even have questions, to know that changes are coming up. So a lot of what we do is focusing on educating the seniors, whether it's by newsletters or by presentations or even individual consults, helping them to know what's coming up, what changes are there, what new things they're getting from the Affordable Care Act, so that they can take advantage of all that.
I mean, there are other parts of the ACA that are brand new, and implementation will be going from zero to something major, and there's a learning curve. There's a learning curve on anything new.
And it's not just older folks who are affected by the new health care law. A lot of people, including young adults who don't have health insurance, will be going online this fall to shop for health coverage in very much the same way senior citizens have been choosing the right Part D prescription drug plan. Explaining all of this will keep Dee McGee and a lot of other people busy for quite some time.
Then you and I need to talk. We do a lot of education on what's really going to happen. Thank you for letting me take your time.